001, which caused all of the electronic prescribing, and it was called the Opioid Initiative for the state of Arizona, had some things that were wrong in it, were not necessarily correct or well described for certified physician assistant responsibilities relative to electronic prescribing of controlled substances. So the governor then signed into law House Bill 2075, which clarified and corrected many of the items in the original bill and a lot of the items that were related to certified physician assistant responsibilities. So today's webinar is focused on physician assistant responsibilities. I did add in here, beyond physician assistants, what are prescriber and pharmacist responsibilities, because they will affect certified physician assistants or PAs as well. I also included the Controlled Substance Prescription Monitoring Program. It's affectionately called the PMP, mandates and access, because it is a mandate, state law, that it has to be checked every time a controlled substance is prescribed to make sure for the past 12 months the different prescriptions that the specific patient has had, so that they're not doctor shopping and you can tell how much of the actual medication they have been given. And I've also included where we are, where Arizona is, and where it versus the national landscape, how we're doing based upon the national landscape. And I have to say right up front, I'm really proud. We're doing quite well. Just a little quick side note, I'm going to start focusing a lot after we get through this session of webinars, which will be in August. I'm going to start working with you on electronic prescribing, because we do need to bring up our folks in the Arizona area on electronic prescribing, because soon Medicare in 2021, Medicare will require electronic prescribing. So we need to get everyone up to speed. Then I'm going to talk a little bit about the online CME opportunity that's available for you, and also a basic little review of what we have going on for our Click Control campaign and where you can get some information. So next slide, please. Let's get into physician assistants and responsibilities. One more yet, Christine. Two more. There you go. There we go. So a physician assistant is certified when a PA is actually writing a script for electronic for controlled substances. And I have to say, within the law, it is described as Schedule 2 controlled substances that are opioids. So that's the way the law is written. And if you look down at the bottom of each one of the slides, you'll see that there's a House Bill, HB 2075, and within that House Bill, and at the end is the section and the lines where you can find the information that's presented on this slide, where you can read the actual law. At the end of this presentation, you will find a link to get you to House Bill 2075. So a physician's assistant is certified for writing a 30-day prescription privileges for Schedule 2, 3, 4, and 5 controlled substances that are opioids or benzodiazepine. Also, 90-day prescription privileges for the same group that are opioids or benzodiazepine. So you can't prescribe any more than 90-day prescription privileges and no more than 30-day prescriptions. Next slide, please. Physician assistants cannot prescribe or dispense or administer Schedule 2 or Schedule 4 or 5 controlled substances more than 5 times in a 6-month period for each patient, and Schedule 3 controlled substances, that is an opioid or benzodiazepine, that is refillable without a written consent of a supervising physician. And prescription drugs for a period of exceeding 1 year. So they can only write any legend or controlled substances for only 1 year. Nothing longer than that for an individual patient. Next slide, please. Physician assistant limits, again, shall not prescribe or dispense or administer controlled substances without the delegation by a supervising physician, board approved, and USDA registration. So the physician assistant must have a DEA registration number of their own. Also, prescription only medication without delegation by supervising physician, and prescription medication intended to perform or induce an abortion. These are just basic things that were included in the law, and they were incorrect originally. Next slide, please. Physician assistant must maintain up-to-date and complete log of all Schedule II and Schedule III controlled substances that they've administered or dispensed. And also in House Bill 2075 in Section 2532, in emergency situations, they may prescribe for MAT, which of course is medication-assisted treatment, and dispensing guidelines and mandates. Next slide, please. All physician assistant prescription orders must contain the physician assistant's name, address, and phone number, and the physician assistant's USDA DEA number. And I have this on the slide specifically because a physician assistant may not use their supervising physician's DEA number. It must be their own DEA number. Next slide, please. Also, a physician assistant, in order to e-prescribe controlled substances, must complete 45 hours of pharmacology or clinical management of drug therapy within the preceding 3 years of applying for their license, or is certified by a National Commission of Physician Assistants, and must meet requirements established by board rules. So the Physician Assistants Board rules, as well as the Board of Pharmacy rules. Next slide, please. So let's talk a little bit about prescriber and pharmacist requirements, because those are requirements that will be necessary for the certified physician assistant, as well as other prescribers. Prescriber may write and a pharmacist may dispense, and I get a lot of questions about this, when the electronic prescribing system or the pharmacy management system is not operational. And both the pharmacist as well as the prescriber must maintain a record of when the systems were not operational or available. That's so that you are covered if you get audited for not prescribing electronically. Next slide, please. So written Schedule II controlled substance prescriptions. A prescriber may write and a pharmacist may dispense when prescription order for federal facilities. In other words, this is about the only time, other than when a system is down, that a prescriber is able to write and a pharmacist may dispense, and their system is not down, to any facilities that are federal, like the VA, military base like at Luke's Air Force Base, Indian Health Services hospitals, or Indian Health Services facilities, or other tribal-owned clinic patients. So you might be prescribing for a tribal-owned clinic patient. And again, if you notice down at the bottom of the slide, you will find where it's located in House Bill 2075. Next slide, please. Also, in emergency situations, you may prescribe emergency quantities for Schedule II controlled substances that may be orally ordered and or dispensed. And also the prescriber may deliver written or electronically prescribed orders to the dispensing physician within 7 days. So in other words, if you write, if you do it orally, if you prescribe medication orally to a pharmacist, you must also deliver to them within 7 days a written or electronic copy of that prescription. Next slide, please. Pharmacists, again, prescriber as well as pharmacist limits, may not dispense more than 90 days after the date of a prescription order, and it may not be refilled. And I include this, while this is basically a pharmacist ruling, the reason I include it here is because prescribers need to realize that if they give a patient a prescription for a controlled substance, and the patient doesn't take the prescription to the pharmacy until after 90 days, the pharmacist will not be able to fill it. So you need to remind your patients that they should get the prescription filled within 90 days. And that is also to protect from back before electronic prescribing, a prescriber would write maybe 3 or 4 90-day prescriptions and give them to a patient so that they didn't have to come in and get another prescription. That doesn't work anymore. They cannot be refilled. So you should not write that many, and remind your patient that they can't get it filled after 90 days. Next slide, please. So beginning on January 1, each prescription order must bear the name, address, and federal registration number of the prescriber, that's the DEA number, and contain only one drug per order. Hospital patient orders may contain multiple drugs, but only one per order, and this is for electronic prescribing of controlled substances. This is for those kinds of prescriptions. Next slide, please. Next slide, please. Initial Schedule II controlled substance prescriptions are limited to 5-day supplies. So no more of, if you're going in for orthopedic surgery, no more can they prescribe you a 3-month supply of an opioid. They can only give you a 5-day supply. And a 14-day supply limit following a surgery procedure. In oncology diagnostic situations, they may prescribe more. And traumatic injury pain management, if someone's in a car accident or other kinds of traumatic injuries, they are allowed to prescribe more. But again, I caution you, please remember to document when you do that, so that if you are audited, you have the information to go back to. Next slide, please. Initial Schedule II controlled substance prescriptions limited to a 5-day supply, except for a hospice patient or end-of-life situations, palliative and or skilled nursing facility patients, burn or MAT treatment. Again, MAT is medication-assisted treatment for addiction, and also for infants being weaned off opioids. Next slide, please. Pharmacist limits and requirements. If a prescriber verbally authorizes, a pharmacist may correct errors or omissions on the written or EPCS orders. And the reason it says written or EPCS here is because if you're prescribing, remember, for a federal facility, you may write. The pharmacist can correct the date issued, strength if it's incorrect, dosage form, pill or capsule kind of thing, quantity, and use directions. If he or she finds something wrong, are able to do that. But it must be, he must call or get in touch with the prescriber and confirm that the corrections he's about to make are in fact what the prescriber wanted made. Next slide, please. And also, if it's verbally authorized by a prescriber, the pharmacist can make changes to the time and date the prescriber granted or authorized to correct the order, and also should verbally write the document on the original order. So you have to document this stuff, and it's probably a good idea to write it on the original order and keep a copy of it so that you have it in case you're audited. Next slide, please. So let's talk a little bit about the controlled substance prescription monitoring program, which most of us refer to as either the CSPMP or the PMP. It is a state-run database that's ran and managed by the Board of Pharmacy that collects all of the prescriptions that are written for controlled substances from the dispensing pharmacies. So it's a list of the past 12 running things running prescriptions or medications for controlled substances that a patient has had. And the purpose of it, of course, is very, very obvious, and that is that it's to improve your ability to make decisions about what you should be prescribing for this patient, so you can see if they already have a prescription from another doctor. It also reduces doctor shopping so that folks aren't going back and forth and around to find the different, to be able to write a different prescription for different, for the same drug for a patient, the same patient. It's also to decrease the inappropriate prescribing, and that's to stop docs from prescribing multiple prescriptions and making sure that the patient is not receiving those from another doctor. Reduce the diversion of controlled substances, and also assist in efforts to control the prescription drug abuse epidemic. And you'll notice that beginning October 16th, 2017, all Arizona prescribers are required to access the information on the EPCS PMP. So please be sure that you do that for any time that you're prescribing an opioid analgesic or a benzodiazepine controlled substance. Next slide, please. This is the actual laws about it, where you can go and read, if you would like to, the different requirements for each medical practitioner, and licensed under Title 32 who possesses a DEA license. And this again reminds you that you're reviewing the 12 months of the patient's PMP before prescribing, so that you know what they have had and you can monitor and adjust your prescribing as necessary. And if there are some exceptions to it, you can go and look at the law, which is giving you the link here. Medical residents may register using a hospital's DEA number. That's a little bit different than a physician assistant may not use their supervising physician's DEA number. They must have their own. But a medical resident may register using the hospital's DEA number. And again, you can click here to the Board of Pharmacy and register. If you have not registered to use the PMP and you are going to prescribe controlled substances, you need to go on to the Board of Pharmacy line and website and figure out how to get registered. It's very easy, and they have some really nice little video kinds of things that will help you get through how to register, how to use it, and the different kinds of reports and things that you can get. You'll also find that the next webinar that will be offered in this series will be done by Lynn Curtis, who works for the Board of Pharmacy, and he talks specifically about the CS PMP and all the reports and different benefits that you get from using it. Next slide, please. So how do you get, once you're registered and you're ready to go with using the PMP, there are 3 different ways you can get to it. One way is you can get to it right via the Board of Pharmacy website, and I've given you the link here. It's a manual login, and you log in with your name, license, and patient's name, and you'll be able to log in, and of course you'll have passwords and things that you need to use. You can also access it via the electronic health record. Many of the electronic health records have begun putting a link into their software so that you can go directly from an EHR into the PMP and back to your EHR. So if you're interested in doing that, get a hold of the Board of Pharmacy and your vendor, your EHR vendor, to find out if they offer that service. Makes it pretty easy. And when Lynn presents on his webinar next, I think it's about in 3 weeks, he will talk about how to go about getting your EHR and which ones are set up to do it. Those of you that are participants in the HIE, the Health Information Exchange, you can also get to the PMP through the HIE portal. So those of you that are participants in the HIE can go ahead and go there and get it as well. All right, next slide, please. So let's talk a little bit about something that I think is pretty exciting, because I know a lot of you have worked very hard, and I know I have, and folks on our team have worked very hard to move us up in the rankings. As of February 2020, we are 4th in the nation for EPCS prescriber readiness. I've given you the link at the bottom of the slide so that you can go and click on our state to find out how many folks are EPCS ready. Doesn't necessarily mean that they've been using it, because some folks are EPCS ready and are not necessarily prescribing controlled substances, but they do have the ability to do so through their either their EHR or any other way that they've decided to do it, a standalone or a phone system. Next slide, please. So where are we in Arizona? And this is as of February. This is the most recent data that I could find. So pharmacies, nationally, 97% of pharmacies are EPCS enabled. And those in Arizona, 99% of them. And the ones that are not, there are a few mom and pop facilities, pharmacies that are not EPCS enabled. And also, of course, the federal pharmacies, some are and some are not. So you may have to, if you're writing for them, you may have to handwrite them. Prescribers, EPCS enabled, nationwide, 51%. Arizona, yay, 74%. So we are 23% ahead of the national numbers. For prescribers and for the pharmacies, we are way ahead, way ahead, almost 100%. So to find that data, I've given you the link on Surescripts site as well. Next slide, please. And here we are. Surescripts does a national report that they have just released for 2019. They do it for the previous year. It used to be it didn't come out until July, but I was excited to find it about a week ago. So here we are. We were in 2018, Arizona was 11th. We have been as low as in the 40s. So we've really come a long ways. We are, for 2019, we have ranked 4th in the nation. And I hope we can come up a little ways with it as well. You can see the others that are around. And if you want to go, if you're from out of state and you want to know what your home state is, and it's not on this slide, you can use the link at the bottom of it and you'll be able to go and find what you need to find for that. I also want you to know that, and I told you this at the beginning of the presentation, I'm going to start after August focusing more on electronic prescribing so that we can raise our electronic prescribing rate within the state. So look for more information about that as well. Next slide, please. This is very exciting and interesting to a lot of folks. Everyone is always looking for free CMEs, continuous medical education credits. So here's an opportunity for a free CME, and it's an online course, which is really great because you can do it from your office or your home. You don't have to give up a Saturday and attend a class. So it's on the, I've given you the link to it here. So go ahead and check it out and see if it'll work for you. It was developed by the osteopathic board as well as the Arizona State medical office, medical education area. Next slide, please. So let's talk a little bit about the Click for Control campaign. The EPCS resources that are on our website, you can go to our website, our Health Current website, and look at the ERX as well as the EPCS web pages, and you'll see webinar registration and a lot of other information. We also have fact sheets on the website, and I tell you about them because sometimes if you're trying to convince prescribers within your organization, you might want to print out one of those fact sheets and give it to them so that they have a better understanding. They can look at it and read about it. There's also the future and upcoming webinars and presentations that you'll find there. our newsletters and articles. And also I can offer you, this you'd have to contact me directly for. My contact information is at the end of this webinar. Um, you would, you'll be able to, I can give you some slides that you might want to add to a presentation that you're giving to your team or someone within your organization. I can provide you with some slides to do that. Also, we offer phone-based assistance as well as email communication. Kind of interesting, in the month of January, I had over 40 calls from folks who were not ready to do EPCS and had written prescription, sent it over to a pharmacy, and could not get it filled. I'm happy to tell you that in the month of March, I only had 6 calls where the prescriber did not realize that they couldn't prescribe written, that they had to EPCS. Had a lot of other calls, but there were only 6 of them who were not enabled to prescribe. Next slide, please. We put in the list of the upcoming webinars that we'll be doing. Like I said, the one on May 21st is for the PMP, the Controlled Substance Prescription Monitoring Program we just talked about. And then there's also 3 more webinars that we're going to do in June, one in July and one in August. And they are actually a repeat of the webinars that we've done through, let's see, it would have been in June, February, March, and April. And then we're going to do them after that. And these are the ones that we're going to be doing. So go ahead and register if you want to see them again. You'll also find that all of the webinars that we have done are on our website, as well as some other websites where folks have some other hospital associations and so on have put them on their website as well. So you can go there and listen to them. They're the live webinars. Next slide, please. I do want to let you know that this webinar is meant to educate and help you understand what's out there and help you navigate the adoption of EPCS. But I do encourage you to look up and interpret the legislation and mandates based upon what works for your particular practice or yourself as you prescribe. Not all things will apply to everybody, so please make sure that you look up the information and find out if you are able to, if you understand and it fits for your practice. Next slide, please. So that concludes our webinar presentation for today. As I promised, I have my information here on how you can get a hold of me or anyone else within our organization. You can email us at erx@healthcurrent.org or call. If you are interested in joining, thank you. If you're interested in joining the Health Current HIE, the Health Information Exchange, there's the information that you need there to click on to find that information. And also you can go to the Health Current website to see all the information that we have about the Health Current HIE, e-prescribing. There's information about many of the access DAP program and all the other programs that are access sponsored as well. So I urge you to check out our website. That actually concludes what we have today. Do we have any questions, Christine?
We do, Connie. Thank you again for your presentation. One of the questions that came in is the CSPMP specific to RXs filled in Arizona only?
Yes, it is. Yes, it is specific to Arizona, and you must be registered to use it. So you have to go on the Board of Pharmacy website, register, sign in, get a password and username, all those kinds of things to be able to sign in and use it.
Sure. Awesome. Thank you. The other question that came in is I was asked to display the slide with the free CME link. for the Arizona Opioid Prescribing Education Program. So I put that back up for folks if they're interested. And just a reminder, we'll be sending out the copy of today's slide deck with all the links in it, so you'll be able to go ahead and research those or dig a little bit deeper, especially into any of the House bills that are out there. Another question came in. Any plans to link various states together to share PMP data?
You know, I don't know the answer to that. I would suggest that you join Lynn Curtis when look up here. He will be presenting on the Controlled Substance Prescription Monitoring Program on May 21st. So I suggest you go ahead and sign up for doing that. And that should help you be able to understand. There you go, Christine. Help you understand a little bit more about it. I also would encourage you to call the Board of Pharmacy and ask that question if you'd like to. I know that it isn't connected now, but perhaps they would know of any plans to link any together. We do the HIE does link things together. It's called your data center home for patients. And what we do, because we're such a state that has a lot of residents, our famous snowbirds in the wintertime, we share data and information with several surrounding states and also with some of the northern states, so that when a patient presents at the emergency room with a zip code from another state, and it is one that the Health Information Exchange is exchanging information with, that doctor in that state will be notified when a patient from their state that's in that doc's area will also get a notification that that patient has arrived at our emergency room or is being admitted. So that may be a little bit reason why you're asking about the PMP. But the PMP, to the best of my knowledge, I don't know that they have plans to do anything with it. Any more questions?
None that have come through quite yet, but again, the chat box is open for folks that are participating on today's webinar. Please feel free to go ahead and type those in, and Connie will be glad to answer them for you. We'll give folks a few more minutes to go ahead and use the chat box for any additional questions for today's EPCS webinar. Connie, again, which webinar is the one the pharmacist will be hosting? If folks are viewing the screen right now, it is the Thursday, May 21st, is the one that Lynn Curtis will be presenting on. So from 12 to 1 p.m. Again, you can visit our website at healthcurrent.org/events and register that way, or following today's presentation, again, the slide deck will be coming out, and you can go ahead and click and register using the link right on the site.
Let me just say one thing about that. Just so you know, Lynn is not a pharmacist. He's very knowledgeable, but he is not a pharmacist. So if you have real, drug type questions other than what's required within the law, he will not be able to answer your question, and you may want to call the Board of Pharmacy directly. Lynn is very, very, very knowledgeable. I'm not saying this because he's not. He is extremely knowledgeable, but he is not a pharmacist. So if you have specific, pharmacist questions, you might want to call the Board of Pharmacy.
Thank you for clarifying that, Connie. Any other questions today?
All right, I think that's enough, Christine. I think we should let them go and give some time back to them for today. Thank you guys for joining, and I'll let Christine finish out.
Yes, thank you again, everybody, for taking your time, and thank you for participating in today's webinar. Stay safe and healthy out there, and look for my email to follow with the slide deck. And the recorded webinar will be posted on our website in the coming week. Thanks again. Have a wonderful day.
Thank you, Christine.